When I make a diagnosis of Parkinson's disease, patients want to know how am I going to do over time. And my answer today is we have some good news, and that's that the medications that we have today usually do a pretty good job for about 5 to 7 years to treat slowness and stiffness. Tremor is kind of a wild card. The dopamine medications sometimes do a great job in relieving tremor, sometimes they do nothing to relieve tremor, and they can do anything in between. We do see a lot of patients who are diagnosed with Parkinson's disease who are put on dopamine medications, their tremor doesn't improve, and then the physician and patient questions the diagnosis. A lot of times that's just Parkinson's disease with a tremor that didn't respond to medication. If slowness and stiffness is present and that doesn't respond to medication, then that calls for a reevaluation of the diagnosis, and a patient may have a different disorder such as an atypical Parkinsonism. But in Parkinson's disease, the slowness and stiffness generally responds pretty well for 5 to 7 years with our current set of medications. Between about 5 and 10 years, by then everyone is on the main medication, which is called levodopa. Its brand name is Sinemet. But over that time period, patients begin to run into some difficulties associated with levodopa. They find that it starts to last a shorter amount of time. Initially, when patients go on levodopa, they can go on it 3 or 4 times a day, and they find it lasts from dose to dose. That's because the levodopa gets up to the brain, is converted to dopamine, and slowly released over time. But as time goes on and individuals lose more and more dopamine neurons, that storage and release capacity is diminishing, so they start to notice, geez, the medication's only lasting 4 hours, then 3.5 hours, then 3 hours, until it's only lasting about 2.5 hours. The other thing that happens is that some patients, especially young patients, tend to develop a sensitivity to the medication known as dyskinesia. And this is expressed as twisting, turning movements, and again, movement disorder doctors will call that dyskinesia. And these occur when levodopa in the blood is peaking and when dopamine in the brain is peaking. So it's a sensitivity that people develop over time. And if a person has dyskinesia, I can reduce the amount of dyskinesia they have by reducing dopamine medication. The problem is they may then have more slowness and stiffness, and the medication may last a shorter amount of time. So we're kind of trying to thread the needle at that point. Too much medication, patients may get too much dyskinesia. Too little medication, too much slowness, stiffness, and off time when the medication's worn off. And the other problem related to dyskinesia is that it's essentially an irreversible change that occurs in the brain. I can reduce or stop medication and get rid of the expression of that problem, the expression of that sensitivity, but as soon as I go back up on the dose, that dyskinesia will reemerge. But anyhow, medications do pretty well for 5 to 7 years. Between 5 and 10 years, everyone's on levodopa, but those problems of the shortened duration of effect occurs, and especially young patients may develop dyskinesia. But the real problems tend to occur even later than that, 12 to 15 years and beyond, and that's when individuals tend to get balance problems and perhaps substantial thinking and memory problems. Now, for these, we don't really have any pure treatment for balance difficulty. For thinking and memory problems, we use cognitive enhancers and medications that help thinking and memory. We generally borrow these from the Alzheimer's field, and they help some. They're of mild benefit, and we do use them very frequently. But we really need better symptomatic treatment for both of these problems, but it's very hard to do at that point in the disease. And thus we think that really the future is not so much in developing better symptomatic treatments that late in the disease, but what we really need are medications to slow progression of disease. And that's why we and others do so much research. If we could just slow the disease by 50%, instead of individuals running into substantial problem in 15 years, if I could say 30 years, that would really represent a great advance. So that's one of the reasons I always encourage patients to try to get involved in clinical trials if they have that opportunity.